Good morning. Over the weeks that it's been since a Liberian patient tested positive with the Ebola virus, the state has been fully engaged on every level of response to this crisis. State Medical Operations Center within our Department of State Health Services was fully activated in early October, with members of that center's Rapid Assessment Team and Command Assistance Team deploying to Dallas to assist the Emergency Operations Unit there. DHS officials have been in constant contact with the Centers for Disease Control and coordinated with federal and local health officials to locate and begin monitoring those that were exposed to Mr. Duncan. The DSHS has also transported and tested samples. They've assisted in the transport of patients and continue to consult with providers and facilities on diagnosing and screening for Ebola. The Texas Commission on Environmental Quality has been actively involved in the handling and disposing of the waste that's been generated by all three patients, including the cleaning and decontamination of those residents. Yesterday, I spoke with President Obama. Among other matters, I asked him, as a stopgap measure, to fast-track CDC acknowledgement of the next-level facilities that are better prepared to deal with diseases like Ebola. This will let people know that there will be a place to go if they get sick in Texas. Over the past few days, 2 additional positive tests, both involving caregivers to Mr. Duncan, reminded us just how dangerous this virus truly is. Both women are currently being treated at other facilities around the country, and they each have certainly our thoughts and our prayers, as do their family. Throughout this process, caregivers across North Texas have demonstrated courage and determination in treating Mr. Duncan, and it's certainly important that we remember their efforts in this face of this great adversity. We must admit, along the way, we have seen ample opportunity for improvement, from the CDC all the way to the hospital. It's indefensible that one of Mr. Duncan's nurses was allowed to fly from Ohio to Dallas after she said that she had a low-grade fever. DSHS has, in fact, been asked by the CDC to monitor the 79 people in Texas who were on that plane with her. The 8 individuals that were in closest proximity to her, within 3 feet, are under active monitoring with 2 temperature checks a day, including once face-to-face with our healthcare workers. The others are being monitored by phone. And that case brings up a good point. Air travel is, in fact, how this disease crosses borders, and it's certainly how it got to Texas in the first place. Based on recent and ongoing developments, I believe it is the right policy to ban air travel from countries that have been hit hardest by the Ebola outbreak. Certainly, there should be an exception for aid workers so that they continue their important work fighting this disease. Again, we have seen on many occasions that things need to be improved in this process. Considering this was the first time that Ebola has been diagnosed on American shores, it's perhaps understandable that mistakes were made, but it's also unacceptable And to that end, 11 days ago, I issued an executive order creating the Texas Task Force on Infectious Disease Preparedness and Response. Today, they submitted a preliminary group of recommendations for our future preparedness. They include establishing Ebola treatment centers in Texas with state-of-the-art equipment and specially trained healthcare workers to provide care to patients when that disease is most contagious. Bringing patients to these centers would be the responsibility of a specialized transport team, also specifically and specially trained with the latest equipment to safely care for those afflicted. They also recommend expanded training for healthcare workers in Texas, and they'll be conducting hearings to determine the scope and nature of that training. They're also calling on the legislature to expand the ability of the DSHS chief to impose enforceable control orders, making it more difficult for people at high risk of infection to ignore directives and for them to limit their exposure to the public, for them to go out into the general public. Also calling for more testing labs in addition to the lab that we already have here in Austin. Texas is only one of 16 states that are authorized to conduct Ebola testing, but having additional facilities in different regions of the state will cut down on the time it takes to diagnose a patient. The important thing for everyone in Texas to remember is that the odds of a specific person contracting Ebola are still exceptionally remote. Many of the steps that we're taking and many of the steps that we have taken have been taken out of an abundance of caution. Ebola is a dangerous, persistent foe, but the threat to the general public remains negligible. And to give you some more details of our findings thus far, I'm going to ask our task force director, Dr. Brett Giroir, to come to the podium. Doctor?
Thank you, Governor. As the Governor said 11 days ago, we launched the Texas Task Force on Infectious Disease Preparedness and Response. Since that day, members of our team have had ongoing provision of scientific and technical recommendations on topics far-ranging from decontamination to the provision of experimental therapies to those who were actually infected by the Ebola virus. We have also worked on a daily basis to begin the process of learning lessons and developing a comprehensive plan. To complete this effort will require substantial time, and you know our first due date is December 1st, but there are already key assessments and recommendations that are unanimously supported by the task force and will significantly affect the way the state approaches Ebola and other high-consequence infectious diseases. Let me summarize these initial recommendations, which are fully detailed on the web and in press releases. As the Governor said, our first recommendation is that DSHS, State Health Services, should designate specific hospitals as Ebola treatment facilities to receive and treat Ebola patients from surrounding health facilities within the state. These facilities should be funded, trained, and equipped to provide the highest level of specialized disease care, including patient management, protection of healthcare workers, decontamination, waste management, and complex coordination. We recommend that DSHS should immediately initiate discussions with the University of Texas Medical Branch in Galveston and its local stakeholders to establish UTMB as the first of 2 designated Ebola treatment facilities in Texas. UTMB, as we all know, is one of the world's leading resources for all aspects of high-consequence infectious diseases like Ebola, and a national center which provides training to professionals from all around the world on these diseases. Our second recommendation is that the task force recommends that all hospitals, clinics, and diverse healthcare providers should have the knowledge, training, and capability to identify a patient at risk for Ebola, to know whom to call for immediate assistance, And third, to implement the appropriate procedures to prevent additional exposures until the patient is transferred. To accomplish this, the task force recommends an array of training programs to educate a broad range of healthcare professionals and responders. We also recommend that state licensing boards implement an ongoing requirement for continuing education on identification and initial isolation of such patients. And as the governor said, we'll be holding a hearing on October 23rd to receive additional input on education and training needs from diverse healthcare and emergency response communities. Recommendation 3 remedies a specific legal issue to minimize the potential exposure of additional individuals to Ebola. Specifically, the legislature should empower the Commissioner of Health and Human Services to issue a control order that is immediately enforceable by law enforcement to assure compliance with restrictions on movement and travel of high-risk specific individuals. And finally, Texas should take all necessary steps to establish at least 2 additional regional centers to perform Ebola diagnostic assays. As the governor said, we are one of only 16 states authorized to conduct Ebola testing through our laboratory in Austin, to which all Ebola diagnostic samples must be transported. Given the size of the state and our population, it is critical for rapid diagnosis and assessment that the state develop additional laboratory capacity for the diagnosis of Ebola and other diseases. In the upcoming few weeks, the task force will be working diligently on a number of additional issues before our December 1st deadline. These include healthcare worker protection, especially given the higher levels of intensive care utilized in the U.S. compared to field hospitals in Africa. We also will be looking at organization and implementation of command and control, including integration of local, state, and federal resources, and a number of other issues as we continue to work with public health and the healthcare teams directly. We thank you again for your support.
Thank you, Brett. I'd like for our Commissioner of Texas Health and Human Services Commission to address you, Dr. Janik.
Thank you, Governor. First, Governor, I want to thank you for the leadership in bringing together this panel. As a physician, I am each day in awe of the amazing talent and breadth of knowledge by the members who serve on the task force. It's an honor to be part of it. I also want to thank the Department of State Health Services, led by Dr. Lakey, one of our agencies, for the amazing work that they've done. Dr. Lakey has been on the ground in Dallas since Mr. Duncan was first diagnosed. And since that time, almost without break, he has been there nonstop, coordinating many efforts, working with state and county officials to make sure that this outbreak does not get any further than it is. With the 3 cases that we've had so far, each one becomes even more critical that we monitor those folks who may have had some exposure to the virus. We know that meticulous contact tracing is the key to stopping any infectious disease outbreak, especially those with Ebola and some of the hemorrhagic fevers. It's worked in Nigeria, and it will work here. We have epidemiologists on the ground in Dallas helping with contact tracing. This is the most important aspect because it prevents the spread of the disease to begin with. It includes those healthcare workers who took direct contact care of Mr. Duncan, as well as peripheral contacts. So out of an abundance of caution, we're catching those that are not just direct contact with Mr. Duncan. Our staff have helped to arrange transport of patients to hospital outside of Texas, coordination with other counties, and very importantly, the proper disposal of medical waste. As we have pointed out, we're proud of the resources that we have in Texas, from the state lab that can serve as a diagnostic point to the many great facilities who are able to care for patients. The task force recommendation that we establish regional centers of excellence to concentrate that ability for not just the best minds, but the best training, the over and over repetitive training necessary to protect other folks from being exposed. Again, I want to thank the governor and the other task force members. Since this task force was created by the governor, most of us have dropped just about everything else going on in our professional lives to focus on this. We've got the right guy that sent us into the battle. We've got the right fella in Dr. Giroir leading it. And I hope you will take time to look at the credentials of the people who serve on the task force. It is quite amazing. Thank you.
Thank you, Kyle. Brett, thank you. And Andrew, you and Nim, thank you both for being here too and the work that you've been doing.